Hello, I'm Dr. Michelle Wright. This is Step by Step, where we take practitioners through important veterinary conditions and issues, step by step. This episode of Step by Step is sponsored by Zoetis, the makers of Solensia, Bernavetmab injection. Solensia is indicated for the control of pain associated with feline osteoarthritis. Using an algorithm, we will walk through how to identify feline OA in order to up your ortho game. Feline osteoarthritis is widespread, and radiographically evident OA is seen in 60% of cats over the age of 6 and a staggering 90% of cats 12 years or older. However, it can be seen in cats as young as 2 years of age. Cats are notoriously good at hiding their pain, so it's up to us to educate ourselves and the owners to look for the signs. So let's get started going through feline osteoarthritis step by step. First, we're going to talk about history. The key factor to identifying feline OA is through a thorough history exam. And I recommend doing a pre-examined screening questionnaire. Email the client with the history questionnaire prior to the appointment and identify how each cat performs daily functions. Send it prior to every wellness and sick exam. And start at 1 year of age so that you know the baseline of normal. Examples should be provided of what normal and abnormal cats do, because the owners don't know. The history form should screen for how the feline patient performs their normal activities. Next, evaluate behavior changes and mobility changes. Starting with behavior changes, look for less socializing, grooming habit changes, litter box changes, sleeping habit changes, or aversion to touch or handling. If we ask how and where, we can uncover if the change was due to pain. For example, where does your cat urinate and how? May reveal the owner seeing the cat urinate next to the litter box because the cat is now standing to urinate due to hip pain. Then evaluate for mobility changes, from difficulty climbing up the stairs or climbing down the stairs, changes in how they chase and move after objects, difficulty jumping up and down, and difficulty running or change in their gait. The answers to these questions are crucial to identifying cats compensating for OA pain. Moving on to our physical exam, it's made up of two different parts to me: abnormalities that are found on hands-off exam and abnormalities that are found on hands-on exam. One key factor to identifying abnormalities on a physical exam is to relax the cat. Let the cat out of the carrier, walk around while you talk to the client and confirm their concerns. Offer them a treat, such as a churro. I refer to this as my peace offering. This calms the cat, allows me to touch it and feel them better for abnormalities. Starting with that hands-off exam, we need to look for mobility changes while they're in the exam room. While they're reaching down, while jumping, or hesitating to jump up on a chair in the room, or maybe they missed the jump altogether. Then look at abnormalities for their body condition score. Do they have a decreased body condition score because they have a decreased appetite due to pain? Or do they have a systemic disease, or maybe both? Are they obese with a 9 out of 9 body condition score? That's going to predispose them to osteoarthritis and give them pain that is going to induce sedentary activity. Then look at the hair coat. Are they grooming? Are they able to reach all of the spots in their body? Or is their hair matted and scruffy in appearance? Do their nails click on the ground as they walk? Or are they doing the opposite and over-grooming? Cats may be grooming over painful joints or down their back. Make sure you rule out dermatological issues as well. Look back in the history. Make sure the cat's on a really good product covers not only heartworms, but fleas, ticks, and mites. as any of these may make the cat overgrown. Now we're going to move on to the abnormalities found during the hands-on exam. First, we're going to look for muscle atrophy. Run your hands down the sides of the cat. If you see generalized muscle atrophy, many muscle-wasting diseases such as hyperthyroidism, kidneys, GI disease could cause that. But I've also seen this in cats with just severe osteoarthritis pain or a combination of both of these things. Then look for focal muscle atrophy. Feel for asymmetry. If you're seeing asymmetry, ensure that you rule out not just joint pain, but neurologic pain as well. I'm also looking for hypersensitivity. We want to rule out neurologic pain, but we also want to look for increased skin twitching, muscle fasciculations, and flinching, and even vocalization as we're touching the muscles, as all of these things indicate maladaptive pain. Then, feel the joints. Put your fingers between the bony prominences and palpate for fusion, crepitus, decreased range of motion, or just resistance to joint manipulation. Here's an example of a severe decreased range of motion in the carpal joint of a 6-year-old cat. Sometimes we find a cat that has a normal physical exam, but an abnormal history. In early OA, we may not feel crepitus or even see overt muscle atrophy. However, the cat is changing how they do things to compensate for pain, and they should be evaluated with an OA pain trial. Begin your diagnostics with an osteoarthritis pain trial, consistent with the AHA guidelines for chronic pain. It's recommended that we should get a minimum database for a full comprehensive exam. This may include a CBC, serum chemistries, a urinalysis or thyroid, a fecal or GI panel, and you may also need to get blood pressure or radiographs. Our pain trial is either going to show us our feline patients can improve and feel great and proves that they have osteoarthritis pain, or it may not improve all the way, or only improve some or not improve at all. And in those cases, we need to reevaluate for other causes of arthritis. Things like fungal, that happen in my area, or even bacterial or autoimmune. And all of those things could make our pain trial fail or not improve as well as expected. Initially, treatment can be done by using either an NSAID or an anti-nerve growth factor monoclonal antibody, such as Solensia, and that is for our pain trial. But then we need to look at long-term management for osteoarthritis pain. Monthly Solensia injections are recommended as they ensure patient compliance and decrease owner fatigue from daily medication administration. It also allows the owner and their cat to maintain a great relationship while improving their feline's quality of life. We've got to set these cats up for success by pre-booking appointments and setting up a reminder system that is easy for clients to do those things. And then use gabapentin before the visits to help lower that stress and anxiety those cats may have coming into the vet. Finally, have the client continue to monitor for behavior and mobility changes. And if they're not seeing that continued improvement, that they follow back up to ensure that we are taking care of the entire body and all systemic diseases. For a PDF of this algorithm and more information about cats and osteoarthritis, check out vetfolio.com and SolensiaVetTeam.com.
Important safety information. Solensia is indicated for the control of pain associated with osteoarthritis in cats. For use in cats only, women who are pregnant, trying to conceive, or breastfeeding should take extreme care to avoid self-injection. Hypersensitivity reactions, including anaphylaxis, could potentially occur with self-injection. Solensia should not be used in breeding cats or in pregnant or lactating queens. Solensia should not be administered to cats with a known hypersensitivity to fernivimab. The most common adverse effects reported in a clinical study were vomiting and injection site pain. See full prescribing information at www.solensiapi.com.